was once a smart, bubbly, and vibrant young man, but all that has changed. He's now suffering from psychosis. He looks tattered and unkempt. He even inflicts pain on himself. This whole thing started as an experiment, just a little bit of fun, a distraction from bad situations, a quest to belong. Because of peer pressure, it has become an addiction. As a result, lives are negatively impacted. There's nothing good about substance use. Say no to drugs.
My name is Kim O'Marrow, and I am a licensed clinical social worker and an alcohol and substance use counselor master. I work for St. John's Riverside Hospital, and I've been in the field for maybe since 1998, 1999. And I want to just say thank you to Trevor Payne, who happens to be here, for connecting me with IFE and the opportunity to come and speak for you today. And how appropriate for mental health to start us off, because substance use and mental health are co-occurring disorders quite often. So just a little bit about substance use, addiction, causes, common signs, and interventions. Forgive me, I'm struggling with a cold. Substance use disorder, which I'll refer to as SUD, is a problematic pattern of substance use that affects your health and well-being, having a strong desire or urge to use the substance, having unsuccessful efforts to cut down or manage a substance, spending a lot of time obtaining or using a substance or recovering from its effects, having issues fulfilling life responsibilities at work, school, home, are related to substance use. Substance use disorder, formerly known as drug addiction, is a mental health condition where you experience a problematic pattern of use that affects your health and quality of life. Substances change how the brain functions over time. These substances release dopamines, which is a chemical in the brain that makes you feel good, and it usually works until the substance wears off. Your brain and your body want to continue the good feeling, and you psychologically, and sometimes physiologically seek out that substance to regain that good feeling.
He was once a smart, bubbly, and vibrant young man, but all that has changed. He's now suffering from psychosis. He looks tattered and unkempt. He even inflicts pain on himself. This whole thing started as an experiment, just a little bit of fun, a distraction from bad situations, a quest to belong. Because of peer pressure, it has become an addiction. As a result, lives are negatively impacted. There's nothing good about substance use. Say no to drugs.
Substance use exists on a spectrum from mild, moderate to severe, and no matter where you are, the condition is treatable and help is available when you're ready. So I'm going to get a little bit of participation from you. Can anyone here tell me some of the substances that are more commonly used? Can we take a few? Hi.
Caffeine, alcohol, marijuana.
You got three of the top ones right there. Anybody else? Cocaine. So we have caffeine, marijuana, cocaine, alcohol. Yes, nicotine, tobacco use, methamphetamine, opioid use, and for some reason, more commonly in Westchester County, there's a big surge of PCP, phencyclidine use. It's common to have more than one substance use disorder at a time, like alcohol use and tobacco use disorder. This is known as polysubstance use. Some people use 2, 3, or 4 substances at a time. Some people try to discontinue their use and they replace one with the other. And old school clinicians used to call that changing ships, jumping from one ship to another. So what is the most common substance use disorder? There's a debate, but let's see who says what. One of the most common substances of abuse out of all of those we talked about.
Alcohol.
You got it. You win my smile. One of the reasons is that, when I was a kid, we used to go to RKO movie theater, and all of a sudden I'd have this great urge for a Coke and some popcorn. And my dad said, they're giving you subliminal suggestions. And I said, what? And then I learned over the years to have, a healthy snack with me, because miraculously I don't eat popcorn, but I get to the movie and I want some popcorn and a Coke. And alcohol use is widely accepted, and on every corner, street corner, in many neighborhoods, there is a liquor store, and there's Budweiser commercials and wine cooler commercials, and there's disco music playing in the background, and really cool people drinking and smoking cigarettes. So how could you not want to engage in those activities? So some of the symptoms and causes, I'm a 60s kid, so other than subliminal suggestion, the symptoms and effects of substance use disorder vary based on the types of substance used. There are two groups of symptoms based on when or if the substance is in your body, and the impact, substance use impact. And the two most important to recognize is if someone is intoxicated from that substance, which is an immediate and short-term effect of the substance in your body. Symptoms include feeling sleepy, calm, exciting, intense emotions, etc. And withdrawal. These symptoms can happen when the short-term effect of the substance wears off. And so there are signs and symptoms of substance use disorder. And similar to psychiatry, social workers diagnose these signs and symptoms according to the DSM-5. And there are a certain number of symptoms that must be checked off in order to determine if an individual has mild, moderate, or severe substance use disorder. And then for someone who has a diagnosis, who is remission from that substance use, we can say they're in, thank you, that's just gonna make it worse, I tried, thank you. She must be a social worker. There are signs and symptoms, and if you have abstained from that substance for a while, you still maintain the diagnosis, but then you go into remission, and there's like short-term remission and long-term or full sustained remission, and these are important for people who are attempting to abstain from substance use. Because for many, it is a never-ending battle, a cycle of recidivism, and I'll get into that in a second. But according to the DSM-5, there are signs and symptoms of substance use disorder, and when we diagnose, we look at these symptoms and we do a check-off, really, to see how many the person meets, how many of the criteria. And so these are taking the substance in larger amounts and for a longer amount of time than you meant to, or than it's prescribed, having a strong desire or urge to use the substance, having unsuccessful efforts to cut down on or manage the substance use, spending a lot of time obtaining or using the substance or recovering from its effects, having issues fulfilling responsibilities at work, school, or home due to the substance use, continuing to use the substance even when it causes problems in relationships, giving up school, occupational, or recreational activities because of substance use, using the substance again and again even when it puts you in danger, continuing substance use despite an ongoing physical or psychological problem that's likely caused or worsened by the substance, developing tolerance, which is the need for increased amounts to get the same effect, experiencing withdrawal symptoms, which can be relieved by taking more of the substance. I think in the old days they'd say more of the hair of the dog that bit you, or something like that, but it doesn't work with illicit drugs.
He was once a smart, bubbly, and vibrant young man, but all that has changed. He's now suffering from psychosis. He looks tattered and unkempt. He even inflicts pain on himself. This whole thing started as an experiment, just a little bit of fun, a distraction from bad situations, a quest to belong. Because of peer pressure, it has become an addiction. As a result, lives are negatively impacted. There's nothing good about substance use. Say no to drugs.
Seeking medical care as soon as you have the signs of substance use disorder is essential. And some people ask, what causes substance use disorder? The exact cause of substance use disorder isn't well understood. However, research shows that the changes to your brain's reward system due to the substance's addictive pattern may cause this condition. Studies have found that factors may be involved in the development of substance use. For example, well, let me ask you, what are some factors, anyone want to take a shot, of what may cause or put someone predisposed to substance use? I'll give you one. Social pressure. Trauma. Genetics. Oh, you guys went to my school. So, social pressure, curiosity of the use of the substance's effects, performance enhancement to do better at work or school, emotional escape like relief from stress, anxiety, fear, or depression. The progression to substance use disorder often follows a pattern. Experimental use, which it could be prescription or a street drug, taking or trying a substance once or using the substance as directed, so that's in the first stage. Occasional use, taking a substance socially or using prescriptions not as directed. So I might have that old Tylenol with codeine for the headaches that I had last summer, and I didn't throw them away, and you know, my cousin has a headache, so I might share my prescription with her, or I might get a migraine again, or fear of. So at the onset of head pain, I'm gonna pull out that old prescription. And it was really just a sinus issue, right? Heavy use, taking a substance routinely with a few to no days off the substance. Substance use disorder. You take the substance daily or multiple times daily, and there are rarely times when you're not using the substance. So we go from experimental to occasional to heavy use to substance use disorder. And many people slip through these stages back and forth, but oftentimes they do not realize that they're in that cycle. So this is just an example. These conditions vary from person to person. Some people go from experimental straight to heavy drug use. So some of the risk factors, there are, I think the lady with the mask said it, you know, psychological factors, which is having an underlying mental health condition, which we call co-occurring disorder, like anxiety or depression, having a biological relative with a SUD, you know, family history, having a history of adverse childhood experiences. We find when we do our assessments, many of our participants have had adverse childhood experiences. All of us may have, but how we rebound, cope, or manage those experiences, which, you know, is a whole nother, that's the doctor's topic, the trauma, the effects of trauma on us as adults, childhood trauma. So having a genetic susceptibility, a genetic variant makes substance use disorder more common. Having exposure or easy access to substances, socioeconomic status, cultural norms, and availability of substances. Environmental or social factors, influence of peers, family, and community. In some communities, I've had participants say to me, everybody in my family smokes marijuana. Everybody in my family drinks wine with dinner and after dinner, or maybe a glass before dinner. And one stereotype when I was growing up is people said, oh, you're from Jamaica, you're smoking the ganja. Everybody from Jamaica does not smoke marijuana.
He was once a smart, bubbly, and vibrant young man, but all that has changed. He's now suffering from psychosis. He looks tattered and unkempt. He even inflicts pain on himself. This whole thing started as an experiment, just a little bit of fun, a distraction from bad situations, a quest to belong. Because of peer pressure, it has become an addiction. As a result, lives are negatively impacted. There's nothing good about substance use. Say no to drugs.
So there are complications of substance use disorder, the impact. One of the more common and most deadly complications of substance use disorder is overdose. We have a drug that is plaguing our society, and who wants to take a guess at what that is? The most common, actually, alcohol use may be the most common, but I don't know. This may be a close runner-up. Fentanyl, opioid use disorder. Because the side effect of that is severe. What is it, guys? Did somebody say death?
Yes.
Yeah. When the antidote is so necessary that you can get it for free at the library or the CVS, that's an issue, right? So, where am I? One of the most common and most toxic overdose. Different substances affect different parts of your body. For example, if you overdose on opioids, it targets the part of your brain that regulates your breathing. If not treated quickly, your breathing slows or stops completely, leading to death. Other complications from substance use. Complications are extensive and vary based on severity and type. Common complications may include, want to guess some more, you guys? All right, I'll cheat. Cancer, depression, infections like hepatitis B, C, or HIV for people who are IV substance users, memory loss, academic or career challenges, interpersonal relationship difficulties, unsafe, illegal, or risky behaviors. For example, with alcohol use, I run a drug treatment program. Did I say that in the beginning, that I work for St. John's Riverside Hospital? Oh, I didn't? I work for St. John's Riverside Hospital. And I run an outpatient substance abuse treatment program at 30 Manhattan Avenue here in Greenburgh. And in the evening program, I'd say a good 85% of our participants, literally, are DWI referrals. And out of that 85%, 80% of them do not believe they have an alcohol use disorder. And then there is a small percentage of those individuals who have had more than one DWI, sometimes 2 or 3. Okay, so there are health consequences, mental health impact, socioeconomic consequences, job loss, and financial difficulties. But despite that, individuals continue to use substances. All substances are not physically addictive. Some are psychologically addictive. The feeling, the memory, the drive for that good feeling psychologically, like the Lay's commercial. You can't eat just one, right? They're so good, so salty, so crunchy, and guess what? I'm a salt and crunch girl. So I stay away from potato chips sometimes because I cannot eat just one. And many of our participants, you know, the clinician treating might often think, or family members might often think, why does he or she keep doing the same thing, expecting different results? Some of it's physiological, some of it's psychological, but the drive is very real. The need, the determination for that feeling, that relief is very real, and oftentimes, if uninterrupted, can lead to serious consequences. So how do we diagnose and test for substance use? There isn't a single test available to diagnose substance use disorder. Instead, healthcare providers rely on a thorough evaluation of your medical history and behaviors surrounding substance use. We call that a psychosocial. They may order drug tests to see how much or how many types of substances are in your system at the time. We often do what we call urine screens, or the clients, the participants say, do I have to give a tox today? So toxing a participant, oral or urine, and oftentimes verbal report. Many people will self-disclose. They may also evaluate prescription drug monitoring programs. There's a database that's associated with controlled substances. And with our nurse practitioner, many times prescription drug use is a silent killer, because people, it doesn't matter your socioeconomic status, and oftentimes the higher your socioeconomic status, the bigger the secret, the bigger the hush, the more accepted the use or misuse is in our communities. And so what happens, and the denial runs deep, what happens is you have the sports fanatic, the athlete who gets an injury playing tennis or basketball, they hurt their back or their, whatever that is in your knee, and you get a prescription for opiate-based pain medication, and they tell you to take, they give you a prescription for 30 or 40 pills, and you take one every 3 to 5 hours as needed. And it's very easy, after 2 or 3 days, you have begun the cycle of physical addiction. The problem is that many people, it doesn't make sense to them. They did not intend to become addicted to that substance. So they do not feel that they have an addiction if they could just. And so what happens is, now that the medical field has become aware of this misuse, the prescriptions are limited, the amounts are shorter, and so what happens when you're addicted to a substance and you no longer can get a prescription? Anybody want to guess?
The street.
Right. Yes, Lindsay. People go to the street. So I had a prescription for an opiate-based pain reliever. My doctor has become suspicious that I'm filling my script too often, and so I cannot get that anymore. I can't sneak it out of a medicine cabinet from my grandmother or my neighbor. So I'm going to have to use the next best thing. An opiate is an opiate to an opiate user, right? And so then heroin and other forms of opiate drugs become the next thing. And unfortunately, they did a whole thing on fentanyl where the size of the top of a pin can kill you. So why is it that people are actively seeking fentanyl and they're not suicidal, not cognitively suicidal, right? So this is a dilemma in our community. So what are some of the signs and symptoms of substance use? There are physical signs, which are changes in appearance, like weight loss or gain or poor hygiene. There are behavioral signs, like secretive behavior, withdrawal from social groups, neglecting responsibilities. Psychological signs, like mood swings, irritability, anxiety, and depression. That sounds a little bit like an anxiety or depression diagnosis, right? But these behaviors are commonly associated with substance use. That doesn't mean that because your child or your husband or wife is displaying these symptoms that they are abusing drugs. But we should pay attention, ask questions, and don't feel ashamed or embarrassed to ask those questions. I run a drug treatment program with drug-using participants who get highly offended when I say, "Did you use today? What do you think I am?" And I say, "A drug addict, a substance user." And it's my role and responsibility to ask you. You can tell me, or we can just wait and see. Because the disease of addiction is progressive. Very difficult to hide drug use or misuse when it's beginning to progress.
He was once a smart, bubbly, and vibrant young man, but all that has changed. He's now suffering from psychosis. He looks tattered and unkempt. He even inflicts pain on himself. This whole thing started as an experiment, just a little bit of fun, a distraction from bad situations, a quest to belong. Because of peer pressure, it has become an addiction. As a result, lives are negatively impacted. There's nothing good about substance use. Say no to drugs.
It's important to remember that these conditions exist on a spectrum of severity. So with the diagnostic tool, 2 or 3 signs indicate mild substance use disorder, 4 or 5 signs indicate moderate substance use disorder, 6 or more symptoms indicate severe substance use disorder. And the criteria goes from tolerance, which is for addiction, which is tolerance and withdrawal, loss of control, continued use despite consequences, are still treatable. So, how is substance use treated? The first step to substance use disorder treatment is withdrawal management if it's an opiate-based or a substance that has a physiological effect. This is where you stop taking the substance, allowing it to leave your body. Depending on the severity, a healthcare provider may offer medications to lessen the effects of withdrawal symptoms, as they can be rough physically and mentally. So a person might need detox or what we call MATs, medically assisted treatment services. After detox, you may continue a course of treatment with therapy and again, medication. Substance use treatment is highly individualized. You might need different types of treatment at different times during your recovery. Several types of treatment settings include inpatient and outpatient settings, as well as short-term care and long-term therapeutic communities. Similar to mental health, right? Substance use therapy. Many different types of therapy can help treat substance use disorder and any other co-occurring mental health conditions. Some examples of effective therapies for adults with SUD include what they call ACT, Assertive Community Treatment, which provides mental health services in the community setting rather than a residential or hospital setting. ACT is highly individualized, and your treatment plan will focus on your strengths, needs, and goals for the future. Cognitive behavioral therapy, which is very widely used in substance use and mental health treatment, helps you identify problematic patterns of behavior and thinking, and you set goals to find healthier ways to cope. So someone may wash their hands 10 times a day. A CBT approach would be to ask that person to journal how many times you wash your hands a day over the course of a week. And then the homework for next week is to wash your hands one less time that day. The same with, per day, excuse me. The same with marijuana or alcohol and any other substance use. We call it harm reduction in some circles, right? So a person may smoke a blunt 3 or 4 times a day. We may ask that participant to make a record or a mental note of how many times they're smoking or what times or what triggers their desire to smoke: stress, anxiety, boredom, loneliness, or the sun came out. And then we'll ask them to reduce that use by sometimes just half a blunt, sometimes just a half a glass of whatever it is that they drink. And others may say, well, that sounds ridiculous, but if you try to eat 1 potato chip and find yourself eating 10, and someone says stop eating them, it may be easier to just eat 5 because I just have to have that salt and that crunch. And then after I eat just 5, I realize that, you know what, maybe 3 chips with my sandwich. And then guess what? Maybe I'll just sprinkle a little salt on my sandwich and I won't eat chips at all. And maybe I can get an apple instead. That's harm reduction in the big girl world. Substance use therapy, contingency management. We use this widely in our program. This type of therapy encourages the participant to set personal goals. When you reach the goal, it's reinforced with a reward. And some people say, why would I reward someone for using less of a substance or who's still using drugs? Or, you know, everybody needs minimal and sometimes maximum encouragers. We all have a desire to be accepted and to do well. That's an innate desire. Right? So if our participant is able to attend program every day as scheduled, and after 5 days, they may get a coin or a token. And at the end of the month, you can change it in for a movie ticket or a sandwich or a Burger King gift card. Some people who are in substance use treatment have never been rewarded, have never gotten a physical or verbal token acknowledging any of their efforts. So for some people, just a certificate of good attendance or a clean drug screen, or at my program we have something called the Breakfast Club. And we literally, when I drive up in the morning, there are literally, unbelievable, I'm rushing to get to work, and there are 8 or 9 participants outside saying, come on, Miss Kim, and I'm like, what the heck? I didn't want to come and they couldn't wait to get here. That's a good thing. And some of it's because they're part of the Breakfast Club, and the whole program is looking for the coffee to be set up, the muffins to be put on the table, and you know, these are things where they now have some level of buy-in and responsibility for themselves and their peers. And then the cleanup crew, which is the crew that comes around 9 o'clock, cleans up from the breakfast club. And then what is this all about? It's about buy-in, it's about acceptance, it's about feeling that you are needed and required and worthy. And these forms of contingency management do better than a movie ticket in many cases. So contingency management is something that many programs are starting to utilize, and it doesn't cost a lot of money. I think with children, doing child therapy, we do star charts and reward maps and things that help the parent to teach the child how to strive and set a short-term goal. They get rewarded for it at the end of the week or the month. Same thing in substance use treatment. There's dialectical behavioral therapy, which the psychiatrist before me spoke on. It's a type of talk therapy similar to CBT, and it's designed to help you manage intense emotions and understand how your thoughts influence your behaviors. Family therapy helps you improve relationships and behaviors within a family or group setting. Motivational enhancement therapy encourages you to set attainable goals. A mental health professional will encourage you to take steps to reach these goals. We encourage our participants to make SMART goals, short-term, attainable goals that are manageable and time-sensitive. If I told you that I wanted to lose 30 pounds by next Friday, you would all say, mm-mm. But if I told you that I am not eating potato chips, and that I'm walking more, and that I'm drinking more water, and hopefully by next Friday, even if I lost 6 ounces, I'm on the right path. And then the encourager is when my coworker says, go on girl, it helps you to go further and to reach that short-term attainable goal. Because if I set a goal to lose 5 pounds, I may not reach that goal, obviously, and then I may say what we call stinking thinking, well, I might as well eat that cheeseburger, right?
He was once a smart, bubbly, and vibrant young man, but all that has changed. He's now suffering from psychosis. He looks tattered and unkempt. He even inflicts pain on himself. This whole thing started as an experiment, just a little bit of fun, a distraction from bad situations, a quest to belong. Because of peer pressure, it has become an addiction. As a result, lives are negatively impacted. There's nothing good about substance use. Say no to drugs.
So, and then there is therapeutic communities, which are like an ATC, Alcohol Treatment Center, which is a long-term residential treatment setting that focuses on helping you develop new, healthier values and behaviors related to substance use and other co-occurring disorders. And I said I run an outpatient treatment program. So outpatient is exactly that. You don't need to be detoxed. And there's outpatient intensive and non-intensive. 4 hours a day, 2 hours a day, or 1 hour a day, 1, 2, 3, 4, 5 times a week, depending on the individual's needs. So participate, another very, very resourceful, but I don't know, they don't have commercials about it, but word of mouth seems to do the trick, and it's been around for years. And it's outpatient self-help programs like Alcoholics Anonymous and Narcotics Anonymous, where the individual, him or herself, is responsible for taking themselves there, and it's a group of people who identify some of the same attitudes and behaviors as you and do not judge, and there's mutual aid, and it's proven to be successful for many, many years. Used to be a source of, it's an anonymous program, but now it's a source of pride to be a member of AA or NA or SA or CA or whatever A you can become a member of. So these substance use, these programs can also play a significant role in the treatment. These programs support behavioral modification through self-help and peer support, group therapy people with substance use disorder and maintaining, group therapy support, with substance use disorder and maintaining abstinence and restraint. Healthcare providers may recommend therapies alone or again in combination with medications. So there are behavioral therapies, medication-assisted therapies, and support groups. The medication therapy, I just want to touch on again because it's very important. Word of mouth is a good way to get the news around. Can help modify the brain chemistry to help you treat certain SUDs and relieve the cravings and withdrawal symptoms, particularly for opioids, alcohol, and tobacco. So methadone for opioids, methadone, buprenorphine, and naltrexone. Alcohol, believe it or not, naltrexone, compensate, and disulfiram. Tobacco, nicotine patch, nasal spray, gum or lozenge, and guess what, bupropion, or another one I can't pronounce, it starts with a V. Prevention, educational awareness programs, community support initiatives, early interventions, and referral to treatment programs. Education in schools, communities, and families may reduce the risk of using a substance or misusing a prescription. Other ways to prevent include following instructions on prescription medications. Do not take more than what's instructed. Never sharing your prescription medication with anyone, and keeping your medication in a safe place. If you have leftover prescriptions, discarding them appropriately with your pharmacy. The risk of substance use increases during times of stress and change. For an adult, a divorce, loss of a job, or death of a loved one may increase the risk of substance use. For a teenager, moving, family divorce, or changing schools can increase their risk. It's important to turn to healthy coping mechanisms during these times of change, like exercising, meditating, or learning a new hobby. Consider seeing a mental health provider if you have difficulty managing these stressors.
He was once a smart, bubbly, and vibrant young man, but all that has changed. He's now suffering from psychosis. He looks tattered and unkempt. He even inflicts pain on himself. This whole thing started as an experiment, just a little bit of fun, a distraction from bad situations, a quest to belong. Because of peer pressure, it has become an addiction. As a result, lives are negatively impacted. There's nothing good about substance use. Say no to drugs.
So what's the outcome of the prognosis for conditions related to substance use? It depends on the severity, the level of commitment to recovery, genetics, and how you choose to cope with the stressors that lead to substance use. Substance use disorder is a lifelong disease, but recovery is possible. Different tools work for different people. Many find success through support groups like NA and AA and ongoing therapy. Relapses are common with substance use disorder. A relapse is returning to a substance after stopping it for a period of time. If you need a detox, you need to go again and restart your treatment. This can be a frustrating process. Relapses can happen after years that you last took the substance, but it does occur. It helps to have a strong support system to rely on if you may be at risk. Your healthcare provider should review your treatment plan regularly. It's normal for your goals to change as your lifestyle changes. You may try a different type of therapy or a new medication. A provider can help you make adjustments. When should you see a healthcare provider or a substance use provider? If you're currently using a substance regularly and are concerned it's turning into a habit you're unable to stop on your own, talk to your healthcare provider or family member or community member that you trust. A provider can give you guidance on how to make conversations about substance use or misuse. New York State Office of Addiction Services and Supports has a provider directory, and you can Google it, go online, or again dial 988 and get connected with a service provider. I hope I did a good job without my slides.